Well, thank you. And thank you for asking me to talk at this conference. I see it as enormously important. You see, our whole idea of reductionist science is now open for investigation. And it seems to be breaking down in certain points. The main point is that we don't know or understand from a scientific point of view what consciousness is. Now, that is a huge lack. There are two views: one that it's just the neurons of the brain, and the other that it's outside the brain, and the brain acts as a filter. This was first of all suggested in America at the turn of the century. So the filter theory of consciousness, I think, probably is going to turn out to be the right one. Now, that means then that if one includes a much wider remit than we have been doing, so the important thing then is the relationship to medicine and to consciousness. And that means that we, in fact, have whole mind medicine now, not just whole body medicine. So in this talk, I'm going to talk about prayer, distant healing, miracles, therapeutic touch, religion, positive thinking, traumatic grief, forgiveness, meditation, and spiritual healing. I'll only do a little bit on each subject just to give you a feeling for how things are. So let's remember that spiritual medicine is the relationship between spirituality and health. When I was at medical school, we were never taught about spirituality and health, but it's certainly now coming into the medical school, because spiritual components must be considered in both physical and mental illnesses. Spiritual medicine must be seen as a dimension of healing. Highest order healing processes of the individual are expressed, leading to healing. So it's the highest order holistic process. That's what medicine is now. And there's a growing recognition that organ-based medicine is very limiting. I mean, we're not just livers or hearts or brains. We are, in fact, whole people. And so mind-body medicine is important. Psychological experience, emotional states, pathological styles of behavior all lead to physical illness. And that's very important to remember. So the genesis of illness, in fact, in many cases, comes from the mind. And psychoneuroimmunology shows how mental states link to physical illness. Fortunately, the demand for spiritual medical courses is going up all the time. In 2008, 59% of UK medical schools had courses. That's only just over half, and that's not all that long ago. It's only 2008. The USA was slightly better because by 2011, 90% of US medical schools had courses. And I have two grandsons who are doing medical courses, and there is a lot more mind-body medicine than there used to be. And of course, spiritual medicine is now central to palliative care, as we're beginning to understand what dying actually means and what the processes are. And I don't have to say this, but compassionate medicine is now recognized as an essential building block of the medical process. Very important. Now, is there any reason, or certainly any reason in physics, as to why we should think beyond the body? And the answer is yes. It goes right back to the 1920s when quantum mechanics was first thought of. The aspect experiment shows that entangled particles stretch across the universe. In other words, we are interconnected with the whole universe, and mind may be able to function at a distance. And if that's correct, then the evidence for telepathy, clairaudience, clairvoyance, and psychokinesis is very strong. So if you're a current doctor coming into medicine, you can't just look at body medicine. You can't only look at mind-body medicine. You've got to look at the whole person and what the person actually is. So we are now coming into a phase when the mind can be expanded. Do you all remember that, I suppose it was only 20 years ago, we were thinking that if you wanted to become enlightened, and enlightened was then saying become much more aware of the universe, you'd go up into the Himalayas, and there you'd sit in a cave for most of your life, and then enlightenment would dawn. It's not like that anymore. It isn't as rare as it was thought to be, and it can now be learnt on courses. And this is Jeffrey Martin's course from California. It's a very good course. 70% of his students succeed. Now, this is all validated by questionnaire studies, etc. And we're beginning to understand what enlightenment means. You go through several stages of it, but this is just getting your foot on the ladder. And it's a transformation from subject-object thinking to non-dual thinking. So what does that mean? Subject-object is I'm looking out and seeing an objective world. Non-dual thinking, there is only one thing. The world and me are one thing. So there's a dissolution of the ego structures. And of course, it is an entrance into the very, very wide mystical experiences that we have. So there's a good book by Jeffrey Martin called The Finders, and that would certainly be worth getting hold of if you're interested. Now let's look at some of the ways that medicine has changed. Therapeutic touch. Do you remember we were told that we should never ever touch our patients? Well, of course you do. I mean, if you have an ill child, what you do? You go and sit on the bed, don't you? And therapeutic touch is a type of healing in which verified scientific mechanisms are involved, but transpersonal concepts are used. And so it isn't just the touch in itself, it's the setting in which it occurs. There's a nice paper by Piszczewski in 2007, and they used a whole armament of mind mechanisms with group discussions, meditation, and diet in the treatment of heart disease, and it works very well. Now, the next thing I'd like to talk about is religion. And Koenig's book in 1991, Handbook of Religion and Health, is a very good place to start. What he showed is that religious factors are involved in the susceptibility to disease. And there are a number of reasons for this. Firstly, that most religious faiths limit self-damaging behaviors, encourage you not to smoke, take drugs, or drink alcohol, or certainly not to excess, which is the point, of course. And you also get a lot of support from attendance at church. And attendance at church, as I will show in a moment, in fact, makes you live longer. A stronger faith, positive relationships, positive thinking, all upregulate the immune system. So that reduces your risk of cancer, protects the cardiovascular system, and improves health. Social support is very important as it's correlated with changes in immune system functioning. And from social support, you of course get positive thinking. There are frontal lobe centers which carry the information about individual spatial functioning and mood states. And this is very important because they feed into the hypothalamus, the pituitary gland, onto the immune system, and to the secretion of cortisol. What we've all learned now is that high levels of cortisol correlate with both depression and anxiety. So positive thinking is a treatment for depression and anxiety. Is it better than medication? Probably, because it will certainly keep you healthy. What about the opposite, traumatic grief? That's very difficult because there's a lot of evidence that traumatic grief, in fact, affects you in a very negative way. The death of a partner and high traumatic grief scores led to new cancers at 6 months and 15 months after the spouse's death. They had a large series of people whose spouses had died, this is Priggerson in 1997, showing that traumatic grief scores led to new cancers. So that's something we ought to be able to do in our society. And of course, the Spiritist movement is one way it can be done and can help. High levels of hopelessness increase risk of heart disease and cancer and subsequent death. Again, we shouldn't be having people in our communities who are hopeless, because that leads to further illness. And the last one I don't like, because anger alters blood pressure and immune system functioning in marital relationships. And this is Keelcott-Glazer's study of married couples, showing that those married couples that were angry right at the beginning of their marriage had a change in their physical health due to the difficulties of the marriage. But the opposite is also true. There are positive effects of religious attitudes and spiritual attitudes. Regular church going is greater than a third reduction in deaths during a 28-year follow-up. That's very good. So a third reduction in deaths during a 28-year follow-up. 35-year study of 268 men showed that men with good psychological health and academic success and optimism were healthier than those who were pessimistic. Now, this is a fascinating study because it builds on the Harvard group of patients who've been studied over a number of years. And so good psychological health, academic success, and optimism were healthier than those who were pessimistic. And cardiac health markers increase with reduced blood pressure, and inflammatory markers significantly reduced in those who were more religious and spiritual. And that's a very modern paper showing that it actually is important to have a religion or a spiritual side to your nature. What about forgiveness? That's very important. What is forgiveness? It's ceasing to feel anxious or resentful towards those who have hurt you. And there are special brain areas in the left frontal cortex which make empathy judgments. Nice paper by Newberg there. The middle temporal gyrus is activated when imagining a known person's response, and the cingulus gyrus is involved making forgivability judgments. What's a forgivability judgment? For example, if somebody steals milk from a supermarket, well, you're not terribly involved. so it's easy to forgive them. On the other hand, if they steal it off your doorstep, then that's quite a different matter. And this is what comes out in Farrow's paper. And of course, there is forgiveness therapy, and this is so important. It teaches people to think more positive thoughts, and there's some nice papers on that. Now, mindfulness and meditation. In 1972, mindfulness was used by Kabat-Zinn in Massachusetts in a group of patients with anxiety states. In fact, I well remember his first papers, which he was giving in meetings at that time when I went across to America to some of the conferences. He had to be very careful, because speaking about mindfulness at that time in just a pure reductionist medicine conference, you'd be seen as really outside the norm. But the interesting point about mindfulness, he found that it had a longer lasting effect than drugs. Now, you should say, well, okay, so less stress on the medical system, but it wasn't that. This led to insurance companies funding mindfulness meditation, and that's now spread worldwide. Mindfulness is a recognized treatment for anxiety states and depressive states. Now, meditation. I can't even attempt a summary of the meditation literature. But those of you who want, do notice the reference by Shen, Chen, and Cui in 2020. It's very modern, which refers a large body of literature showing the effect that meditation has. It's astonishing. It shows the different brain areas involved in different meditations. So the brain and brain volumes all change. And note this one particularly, that meditation repairs the telomeres and lengthens life. The telomeres, if you remember, are the caps on the end of the chromosomes. And with each cell division, they get degraded until finally the cell can't divide anymore. And so it's related to the length of cells, the length of life, by cells being kept dividing. Nice papers on that. And then don't forget this, that increased thickness of cortical areas where there is massive amounts of information, improved brain function, emotional regulation, and it improves attention and cognition. So meditation is now a central behavioral method of improving health. And I'm sure everyone in the audience, in fact, is a meditator. And I was particularly struck by the super radiance effect. The studies relate to TM meditation. And there's a very large study, which is actually a compilation by Jeremy Old in 2017. And he showed very convincingly that a group of trained TM meditators could have a positive impact on, and this is in the area which they are, the socio-economic trends. There's a reduction in crime, socio-economic trends, people don't steal as many bicycles, etc. Crime, terrorism, and war. And I would certainly recommend that paper for you, because it's quite clear now that what we really should have are groups of meditators in every community. Now, spiritual healing, does it occur? Yes, it does. And there are some papers, actually there are a lot of papers on this. Dan Benall published a book which showed over 500 healing studies. 191 were controlled studies, and of these 191 controlled studies, 124 demonstrated a significant effect. So there you are. Spiritual healing has to be one of the things that we take account of. People have broadened this out, and there are beginnings of a number of papers on shamanic healing, and there's one which I put in here of temporomandibular joint pain, and that suggested that shamanic healing could help it. And we're coming into another group. It's the power of storytelling and healing. We tell ourselves stories all the time, and in fact, some people would feel that our reductionist medicine story is a story which needs to be changed. It's very powerful at the moment. If you try and put a grant application in using reductionist medicine, it's much less chance of getting funded than one which uses the sort of techniques that we're talking about. So storytelling and healing is important, and there's a reference for you. Now, the role of the shaman or doctor in storytelling and healing is really just taking this into a wider social network. Prayer, of course, widely practiced in America. 64% of Americans pray every day, and 10% did so several times a week as well. So that's about 3/4 of Americans pray. The literature on prayer has become a bit confused. Coronary care patients, this was one of the first ones by Bird and his co-workers, and it was a double-blind study. They half the people, or a number of people in the coronary care group, were prayed for, and Bird was able to show that there was a marked reduction in a number of symptoms in those who had been prayed for. But there are points against prayer. The first one is that God may not comply with a random controlled trial. I mean, you can't get away from that, really. But maybe it's not looking at prayer the right way. It's an interlinking between two people. People are prayed for all the time is another concept. So that may weaken, you may feel what you're doing. And the other thing is that prayer is not a unitary concept. There just isn't one prayer. There are many different forms of praying. And the mental state of those praying is important. This is a sort of study which is a little bit off the wall. It was published in the British Medical Journal. It was in their Christmas issue, which is when they do publish unusual papers. And it was a very large trial. About 1,000 cases with blood disorders were divided randomly into two groups. These are the notes of these patients that had been treated in hospital and, in fact, then went back into the community. Now, one set of notes was prayed for and the other was not. And the interesting thing is that the groups, in fact, did turn out to be different. The prayed for group had shorter admissions and were not so ill as the control group. And so it suggests that a flow of linear time seems to have been violated. It's an interesting study. And of course, there's been a lot of criticism of it. But nevertheless, it's the way that one can start to think more creatively. I want to tell you this one. When I came across it, I was really impressed. It's a stunning case. It's a blind girl with junior macular degeneration, or Stargardt's disease. This is where the macula, remember the sensitive part of the eye, of the retina, starts to degenerate. And you get a loss of most central vision. And this occurred for her, firstly, in 1959. Her vision was lost to counting fingers. Counting fingers means you hold a hand up in front of them, and they they count how many fingers you're holding up. And in her other eye, it was seeing whether or not a hand was moving. So her vision was appalling. And in 1972, her husband put hands on her head and prayed to God to heal her. And this is what the blind girl said. What people need to understand is I was blind, totally blind, and attended the school for the blind. I read Braille, walked with a white cane. My husband prayed for me. Just like that, in a moment, after years of darkness, I could see perfectly. Astonishing, because you've got the whole thing there set out before you. Her eyes also showed true physical deterioration, which improved. And the author, who's Romez et al. in very modern 2021, said that they went through, it's a very good paper because it's got a lot of references to hysterical dissociation, hysterical blindness, and so on. But this wasn't. This is real blindness, well described and attenuated. It's easier to test prayer mechanisms on biological systems. And there is a nice series of papers looking at the inhibition of seeds by salt solution. And so what you do is you take salt, put it into the solution, so the seeds won't generate so well. And then you pray for one group whilst you don't for the controls. And there was a clear positive result of a healing mechanism on the cells that were prayed for. That's the Spindrift papers in 1993, and a later group was published in 2003. So there is evidence for that. Miracles, of course, defined as an act of healing attributed to intervention of God without a clear physical mechanism. And you remember that, in fact, this was defined as without a clear physical mechanism that we haven't yet discovered. The long Christian history at Lourdes, some papers on that, and changes in the structure of brain in 84 healthy Roman Catholic women correlated with a belief in miracles and spiritual well-being. In other words, to believe in these things, you have to have a different brain. And who knows if you, in fact, set up different filters within the brain, which allows miracles to occur to you. Feelings of belief correlated positively with volumes of the temporoparietal junction and negatively with the medial frontal cortex. So this is suggesting that, in fact, there are differences in the size of the brain. This is the Christmas issue of the BMJ again, which I've talked about. Gardner asks if miracles happen now like they used to at the time of St. Cuthbert. He describes a man in Africa who fell off a roof. People gathered round the injured man who lay dying with a bleeding liver. They all gathered round and it was suggested that they pray. As they did so, the injured man returned to consciousness and started improving. So that's the Xmas issue of the BMJ. And yes, there was a nice story that I had. He wrote this story in his paper. When modern missionaries left some gospel books behind in Ethiopia and returned many years later, they not only found a flourishing church, but a community of believers, among whom miracles like those mentioned in the New Testament happened every day, because there had been no missionaries to teach that such things were not to be taken literally. And remember, this goes back to our storytelling again. So there is a definite need for spirituality in reductionist medical science. So thank you very much for your attention.